Hi, this is Dr. David Tenner, and we are here at the Goldberg Clinic, where we specialize in chronic disease reversal. And today is March 11th, 2016, and we're joined today by Peter Gonzalez and his girlfriend Tori. And Tori and Peter are both students of Dr. Goldberg's over at Life Chiropractic College. They're going to be chiropractors themselves before long. They'll both be excellent doctors, I'm sure. But Peter came to see us back in November of last year, 2015, and he came to consult with us about some health issues he was having. So, Peter, I'm going to turn the floor over to you.
Sure.
Just tell us a little bit about the kind of problems that you were having when you came in.
Sure. I was suffering from chronic debilitating migraines. I was having them probably 1 to 3 times a week. Sometimes they were twice a day. And I also was having asthma and allergies, especially with cats. And seasonal allergies. I would get really bad asthma. A few times recently I had to go into the urgent care and get like a steroid shot, breathing treatment, and almost passed out and was really struggling with that stuff.
Okay, so Peter was having some pretty significant issues, and I'm sure they were interfering in your day-to-day life quite a bit.
Absolutely.
Tori, what was it like watching Peter go through some of those episodes?
Scary for the asthma part of it. He didn't want to have to go into urgent care, but I convinced him because I wanted him to make it through the night breathing. But the migraines, I've had a few myself, so I can kind of relate to the pain, but I can't imagine having them as frequently as he did. And so it was frustrating I felt frustrated for him having to watch him go through that.
Yeah.
Okay.
I mean, they were getting the blind spot. You go blind, you can't see, you have to go in dark room for the whole day.
Okay, so it really interfered in your day-to-day life. What kind of things had you tried or had been prescribed for you? I'm sure you did some things to try to help yourself too.
Sure.
What kind of things had you tried to improve that situation?
So with the asthma, I was taking medication for that, just taking an inhaler every morning, and that would help a little bit. But then having an asthma attack, that did almost nothing for me. I would just keep puffing the inhaler, it didn't really help. And also it was just kind of like, here's medication for the rest of your life. And I didn't really want to do that. With the migraines, I've been trying chiropractic care for quite a bit, and I've had some relief with chiropractic where it would get better for a short period of time and then come back, and then try different techniques that would work, and it'd be months without migraines and then come back, and it was going back and forth like that. Mm-hmm. So never really any consistent solid relief.
Okay. Well, there are two areas to look at with most patients, and we did this with Peter, where when patients have chronic health problems, they're usually a combination of biochemical issues and or biomechanical problems. And Peter had been doing some chiropractic care, working with his nervous system, his spine, and gotten some temporary relief, but that did not address any of the biochemical or metabolic factors that may have been contributing to his problems as well. So that's where we came in. We looked at Peter from a metabolic standpoint, a biochemical standpoint. We sat down with him back in November. We took a good history. We spent a good deal of time with him. Did a physical exam as well, and then did some functional testing so we could look at his body's chemistries and see where the areas that were having problems, what wasn't functioning well, and what factors were triggering these asthma and allergic type attacks, and then also the migraines. And those things seem to be related too, right? So, Peter, it's been now, let's see, we actually started working with you in early December, so it's now March, so it's about 3 months. And Peter's been working pretty hard. Based on the evaluation we did, we developed a program that we put him through, specific to his needs and individualized to what we found with him. And Peter has had some very nice improvements since that time. So, Peter, tell us a little bit about what's changed and also what your experience has been like through the process as well.
Sure. So making a lot of these changes in my life it's been quite an experience, and the way I feel, it's probably the best I felt that I can remember, at least since I was like a child. But the asthma, it's night and day, and the allergies, she has a cat, so going over her place and staying over there, I would be just constantly using my inhaler. It'd be the point where I'd have to go outside, and wheezing, like really a lot of difficulty breathing, and then if I was sleeping, she'd say it was like terrifying to you, like that. And now, actually last night, staying over at her house, I didn't wheeze at all. I don't have to use my inhaler. I can breathe totally fine. I wake up and my nose isn't stuffed, my eyes aren't all teary and watery. I feel as if I'm sleeping in my own bed where there is no cat. And then as for the migraines, those have made such an improvement. They were getting really bad to where they were like 1 to 3 times a week, sometimes twice in a day. Now I had 2 in the last 3 months, so it's quite the difference.
Very nice. Tori, have you noticed any changes with, what have you noticed yourself in Peter? Besides the ones that you mentioned.
Yeah, the ones he was saying, just more energy. I think that's a big one.
Yeah,
more energy, being able to stay awake in class during the week. But even just in the nighttime, obviously, we get to a certain point that we get tired, but we couldn't even watch like a full movie or TV shows without you falling asleep. And now that's different.
And that's the nice thing too, is a lot of times patients will come in for certain specific problems they want to improve upon, and then as they get healthier, they notice things that they didn't come in for start to improve too. They say, oh, my skin's better, my energy's better, this is better, that's better, which is part of the perks of just getting healthy all over.
Sure.
And that's the benefit, I think, of what we do here, is we don't treat any particular symptom or condition, even though we work with people with just about every health problem. And rather than treat symptoms or conditions with drugs and pills and potions and therapies of one kind or another, we're really trying to get down to the root cause or root causes of a person's problems, and then have them start doing the right things so their body can start to evolve back into good health. And as that happens, the patient then learns what they need to do to stay well. So it's an educational process in addition. And now Peter, as we progress with him over the next few months, we're going to be seeing him less and less and less, because he'll know what he needs to do now to stay well, to keep himself healthy. And so we essentially, as Dr. Goldberg would say, turn healthcare into self-care, which is, we think, is the best form of healthcare, right? To be able to take care of yourself. So Peter, thank you for joining us. Tori, thank you for joining us as well, and for sharing your experience with our audience.
Sure, thank you.
All right.